Welcome back as we wait for President Cyril Ramaphosa to address the nation at 8 p.m. this evening after his European tour. South Africa and India say there's no reason for reaching consensus on intellectual property rights on COVID-19 products being delayed. Germany and the United Kingdom are opposed to TRIPS waiver, saying it will discourage research and innovation by pharmaceutical companies and countries. Speaking during the virtual BRICS summit on TRIPS waiver, South Africa and India have again emphasized the need for the WTO to push for TRIPS waiver. We're now joined by SABC News international editor Sophie Mokoena. Sophie, let's just start with the BRICS countries and their discussions today around access to vaccines. So it's focused on the manufacturing of vaccines. As you mentioned, South Africa is still very firm on the TRIPS waiver. So how far ahead is the battle?
Today, the ambassador of South Africa in Switzerland, she is also responsible for the talks at the WTO, indicated that they believe that an agreement can be reached at the WTO, saying that there was a confusion in terms of when you implement this, how long will this take? But she indicated that what they are talking about is a temporary waiver, not a permanent waiver. Therefore, when you look at the discussions currently, we know that the WTO and the World Health Organization had a meeting today to prepare a text that they can present in front of the negotiating team to kind of have a guidance in terms of what needs to be done and how all member countries are kind of making their inputs on this issue. Let's take a listen at what the ambassador of South Africa in Switzerland had to say about the issue of perhaps the duration of this waiver.
We have put forward now that the waiver will be applicable for at least 3 years. And the 3 years is informed by a number of research that shows that it will take 3 to 7 years for the global population to be able to be vaccinated, or at least for us to be able to reach global immunity. So while many of the studies show 3 to 7 years, we thought that it is important to rather look for a more shorter duration. But if you look at the proposal, it also gives an opportunity to the General Council, which is the highest decision-making body in the WTO in between ministerial conferences, to look at whether there is still the exceptional circumstances that warrant that the waiver continues if those exceptional circumstances cease to exist.
The intention with the waiver is to ensure that you have access to vaccines. Even the poorer countries are able to have access to vaccines. And those countries, particularly in the developing world, they are able to manufacture all those products that are used for combating of the COVID-19. And we know that countries such as South Africa, Senegal are ready to do just that.
So as you say, it's a push by the Global South. So India itself is already in the manufacturing and design space of COVID-19 vaccines. What is it saying about this?
Well, India indicated that when you look at what transpired in India 2 months ago, a number of people who died in India, India is questioning the role of WTO to ensure that they assist India as a country that is already functioning in this space, and indicating that they have capacity and they are willing to assist the world. Let's take a listen at what India had to say during these discussions in the BRICS nations.
The Indian anomaly is mainly due to the fact, it is an anomaly due to the fact that we are supposed to be the world's largest vaccine manufacturer, and yet we're in a vaccine crisis. I've experienced this personally as well. Many in the country have. There's been widespread chaos and confusion in terms of who can access doses. The vaccinations are open to a population of potentially 945 million people in this country. That necessitates having 1.9 billion vaccine doses on hand. We don't even have, at the moment, 100 million vaccine doses on hand, which makes it a very difficult situation to operate.
With rising numbers on the continent, as indicated yesterday by the WTO, I think this issue is quite important, and particularly the President tonight, he is going to share some light in terms of measures that are going to be taken to address the problem of rising numbers in South Africa, but this issue is very important.
All right, thank you very much, Sophie Mokoena, SABC International News Editor.